Hello, I'm Peg Bolgioni, Communications Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. I will be talking about Rutland Regional's campaign to bring advanced nuclear cardiac imaging to our community and the benefits of this new technology. My guests will include Dr. Michael Robertello, cardiologist with the Rutland Heart Center, Dave Wolk, Rutland resident and past president of Castleton University, and Traci Moore, director of the Rutland Health Foundation. We will return to the program after this message from Rutland Regional Medical Center.
Welcome to Rutland Regional Medical Center. We are Vermont's largest community hospital with 37 specialty clinics. Healthcare organizations have always fixed people once they're broken, but at Rutland Regional Medical Center, we do more. We provide nutrition counseling, weight loss help, smoking cessation classes, all the things that help the community and individuals stay healthy. And we do it all with this promise: to listen, to respect, and to care, always.
Welcome back to Window on Wellness. I'm very happy to have as my guest Dr. Michael Robertello, cardiologist with the Rutland Heart Center. Dr. Robertello, thank you for joining us.
No, my pleasure.
And I think we're going to be talking about the nuclear cardiac imaging machine. And so if you could just start out as to what exactly is nuclear cardiac imaging for people that don't know.
So nuclear cardiac imaging is a specific type of stress test that has been around for many, many years. It's not something that just has developed, though the technology has improved through the years. A lot of folks may know what a regular stress test is, where you get on a treadmill, you have wires hooked up, and we monitor just your electrocardiogram, we monitor for symptoms. What has happened is that regular stress testing can have a high incidence of false positive, high incidence of false negatives. Mm-hmm. So a number of years ago, it's actually been decades, they developed a technique where we inject a cardiac-specific isotope, which is a radioactive tracer, during the stress test. And so what happens is that, as opposed to a regular stress test, we have an IV in place, it's put in, and we get you on the treadmill, you're all hooked up, and we monitor your heart rate, we monitor your blood pressure, we monitor your electrocardiogram, and at peak exercise or with symptoms, we inject this tracer. And the tracer is very specific for the heart muscle, and it's taken to the heart by the blood, and it becomes it's a flow-directed type of techniques. In other words, if the flow is decreased, when we go and take our picture with the nuclear camera, we'll see an area of the heart that's not getting blood like it should. Mm-hmm. In normal hearts, we should see a nice perfect flow. So it's really a way to measure perfusion, and it's a functional test. Mm-hmm. It's been around for 25, 30 years. We have tremendous amount of data, outcome data. It's been a valuable tool because when we use this type of test, it helps us guide who needs to go further, more invasive testing. So this is a non-invasive way to get information about blood flow, prognosis. It's a valuable technique.
And I recall reading that it can also be an indicator of folks that might have had an incident of a heart attack. Is that accurate?
Yes. So what happens is that when you have a heart attack, blood flow is acutely interrupted to the heart muscle. Mm-hmm. And when that happens, that muscle scars. And when we do the technique, it's usually a two-step technique. We'll do a resting image where we inject the isotope at rest, and we take a picture. So that's a perfectly calm, normal resting state. Mm-hmm. And then what we do is we compare that, and the resting state, we expect that that's the maximum amount of blood flow to all the vessels. When we do the stress test portion, if there's been a heart attack, both the rest image and the stress image will show a defect. Mm-hmm. If there's an area of reversible blood flow abnormality, which was most likely the reason that they're having chest pain, we'll see that the stress is different than the rest. And that usually then requires us to move on to the next test, which is a cardiac catheterization.
Okay. And so this particular procedure, what is the most, if people were listening and wanting to understand this, why is it important for them to have this test?
So I think an important concept is not everyone needs to have a stress test. A stress test is a tool that your physician will use to help try to answer a question of a specific problem. So if someone's having problems with shortness of breath with exercise that maybe they feel is inappropriate, someone's having some chest symptom, whether it's pain, pressure, burning, or tightness, especially if it comes on with exertion, this is a test that we will then do to try to find whether the symptoms you're having are cardiac in nature. We do not recommend routine cardiac testing, whether it's a nuclear stress test or a regular stress test, because the issue is that even with nuclear stress testing, there's a small incidence of false positives, false negatives. So we don't recommend routine screening, because if we get an abnormal stress test and you feel great, what does that mean? Or if you have horrible symptoms and your stress test is normal, we don't just stop there.
Right.
So valuable tool, but it's a tool that helps us with clinical interpretation to determine where our treatment needs to go from there.
Okay. So I know that the hospital is in the process of raising money for a new machine, a new advanced cardiac nuclear imaging camera, I
Right.
should say.
Right.
And so can you maybe explain the distinction between what you have now, the machine you have currently, and the upgraded version?
So the machine we have now is very advanced compared to the machine that we had a decade or so ago. And the machine that we're going to be getting allows us to use less radioactive isotope, which is good for the patient because you're not being exposed to radioactivity. The test is shorter in duration. The pictures are more precise and more accurate, and the hopes are going to be that, as we had with this generation compared to our old generation, is that the degree of accuracy is going to be so much better, so that we're going to run into less issues of false positives and false negatives.
Okay. And so are the procedures similar, I mean, between the two machines? So if you were to walk through, the timeline for when the person actually comes in and has to go through the process, can you maybe explain that again?
Right.
For the new machine?
Right. So the technique is going to be the same for both the old machine and the new machine. When you have a cardiolite stress test ordered, what happens is that you'll show up and you'll come into our stress lab area. An IV will be put in, and you'll be injected with the isotope. Now the amount of isotope with the new machine will be much less. And contrary to what you would think, less isotope, you think the pictures would be worse, but they're not. And then the same procedure is repeated after you're on the treadmill. You get injected again, and then you come from the exercise room to a camera. You lay on your back, and they take a picture. The duration of the pictures, the duration you have to lay still on your back, is cut short tremendously by this new camera. And the reason why that's important is that it's very hard to lay still with your hands up over your head. And so the less time you have to spend laying still, there's less motion artifact, and then again, it increases the sensitivity, and the interpretation of the pictures are better, and then you get better information.
Okay. So in terms of when will this new technology be available to patients?
So I'm hoping it's going to be ready. There's a few things that we have to do with our current equipment. We have to remove it, which is a big undertaking. We have to kind of prep the room, and then we got to get the camera in, and then we got to get the camera tuned up according to the engineering specs. So it should be within the next 6 to 8 months. I don't know the exact timeline, but it's going to be. It's not going to be years. It's going to be months. Okay,
excellent. So I guess a final question would be anything else you want to add about the machine, about the technology that our audience should know about?
I think it's important to know that though we are a community hospital, one of the things is that it doesn't mean that we do not have cutting edge technology, and it also does not mean that we're not on the cutting edge of what's current in treating cardiology. We may not be a big center, but we see a lot of pathology. We have 4 very experienced cardiologists here. We see a lot of patients on a regular basis. We see a lot of pathology. We have a very good working relationship with our tertiary referral centers. We're very used to seeing sick patients and getting them dealt with appropriately and quickly, and then they come back to the community where they get their care, ongoing care.
Okay, well, thank you very much, Dr. Robertello, for joining me here today.
My pleasure.
And welcome to Window on Wellness. My guest today is David Wolk, who is a Rutland resident, born and raised. He's also the past president of Castleton University, and he has a very deep and long connection with Rutland Regional Medical Center. Dave, welcome to the program.
Thank you. Glad to be here.
Yeah. And I think what we're going to be doing is talking about the nuclear cardiac imaging machine and the campaign that is kind of launched right now. And so I guess from your perspective, why is this technology so important to the Rutland region?
Well, the folks in Rutland deserve to have the camera, the advanced technology that would allow them to have any potential coronary disease detected early enough so that treatment can take place. About half of us now nationally have some form of coronary disease, whether it's high blood pressure or more advanced disease. And, you know, there are causes for that, you know, smoking, being overweight, here's evidence of that, not getting enough sleep, but all of us will eventually encounter some kind of issue with heart disease. Half of us do already. So the important thing here is to have the cutting edge research, top of the line equipment so that patients who deserve to have any potential problems detected can have it done here quickly and not have to wait for an appointment in Burlington or Dartmouth or Albany or someplace else. It's really important because it could save lives. And there's evidence of that.
And can you tell us more about your personal experience around as a cardiac patient and you know, how this has helped you with your diagnosis and recovery?
So I'm probably going to violate all kinds of HIPAA rules right here, confidentiality. But before I do, I just want to say we're here in the Dr. Art and Flory Wolk Meditation Center here at RRMC, which my wife Lynn and I supported, and would encourage anyone who wants their moment of Zen to come here. And it's just a beautiful place, the main floor of the hospital. And the idea was for patients and staff and anyone who needs that time to have a place with the beautiful music, soft lighting, my mom's paintings around here. And so it just shows our connection here. In my situation, I have Graves' disease. It's treatable, and it causes hyperthyroidism, and it causes atrial fibrillation, which I was in from July of 18 until right around Thanksgiving when my mom passed away. And I've gotten great treatment here. I was in Florida for a while when my mom was there, and now we're living here permanently. But you know, without casting aspersions on any place I've been, the quality of medical care here through the Rutland Heart Center, my doctor is Dr. Mike Robertello, who is just an A+. They're all really good, and we're lucky to have them here, and they deserve to have the best equipment. We all in our families know of situations where early treatment is the best, and this will allow the good doctors here, the amazing nurses and medical staff at the Rutland Heart Center to have the technology for all of our patients. It's not something that the hospital can purchase on its own. It's something that in communities like ours that have community or regional hospitals expect the community to support. And Lynn, my wife, and I have already made our donation because we think it's that important to get early detection, treatment, and it can save lives. That's the important thing.
And I mean, I know you've touched on this earlier, but is there anything else that you wanted to add, you know, the campaign or about technology and why people should really support this?
Yeah, an example I think is the Foley Cancer Center, which has benefited from a lot of community support to purchase equipment technology that allows patients to get served here in Rutland and not have to travel and can have the comfort of really good doctors. And it's the same with cardiologists too. I mean, anyone who's interacted with folks in the Cancer Center or the Heart Center knows that these men and women are compassionate, caring, competent professionals. We're so lucky to have them. You know, in Rutland, to have such high quality medical care, frankly better than I've experienced elsewhere, is something that isn't well known or well recognized. And having this equipment would allow them to get to the next level on behalf of patients, and it will save lives. So that's my motivation for this, to try to help the hospital raise the money for the equipment. And also because, you know, I have a soft spot for the hospital, and my dad, you know, worked here for 40-something years. I can't remember. I spent a lot of time here as a kid, and I love this place. And I'm very confident in the leadership here. Claudio Fort is an amazing leader and has already fallen in love with Rutland and Rutland with him. And the folks here, you know, I've spent probably more than enough time here as a patient, but visiting a lot of friends and family here over many years. And it's a very special place. You know, sometimes we take RRMC for granted. We shouldn't, because as far as I'm concerned, it's the best community hospital in New England. We're lucky to have RRMC. So I'm just hoping that we and others can support the Rutland Heart Center in purchasing this equipment, because our patients will benefit from it, and it will save lives. That's the important thing.
Thank you very much, Dave. It was a pleasure having you on
Thank
the
you.
show, and thank you for sharing your story.
Yeah, glad to be here. Thanks.
Welcome back to Window on Wellness. I'm very pleased to have Traci Moore, Director of the Rutland Health Foundation, with me as my guest today. And Traci, welcome.
Thank you, Peg. It's great to be here.
It's always nice to see you.
Thank you.
So I guess we'll get started. I know the Rutland Health Foundation is launching a campaign to purchase a new advanced nuclear cardiac imaging machine. And so why don't you tell us about the campaign and how things are proceeding?
Well, thanks, Peg. We're really excited to launch this campaign in the community. We are planning to raise $500,000, which will fully cover the cost of the new nuclear medicine camera, and we'll plan to do that over the next several months. So we will then move into the planning for the hospital's Green Mountain Gala, which this year is scheduled for Saturday, June 8th at the Killington Grand Hotel. That is our largest fundraising event of the year, and this year it's dedicated in support of the new nuclear medicine camera. And we will do a variety of different grant writing and donor solicitation over the next several months. And ideally, we'd love to finish the campaign up by early October 2019.
All right, excellent. And so let's talk about the new camera. It is actually an upgrade to the existing camera, correct?
That's correct.
And so what are the benefits of this new technology?
The camera itself, which is a fairly large machine, is a little bit more comfortable for patients. There are some comfort design changes to the camera, and there is a lesser scan time, so the patient actually is on the machine for a shorter amount of time, which should improve the patient experience.
And there's also, if I recall, less radiation emission.
That's correct, yes.
Clearer, sharper images. That's great. So probably leading to better or more positive patient outcomes.
That's correct, yes. I know the Rutland Heart Center physicians and staff are really excited about the upgrade and the new technology, and the fact that it will help to improve the patient's experience, and those images will be a little bit more precise, sharper.
Well, it'll also be nice that folks won't have to travel for this type of testing. You know, so they won't have to go to Dartmouth or to UVM, because I know traveling can be a strain, you know, in addition to dealing with illness.
That's one of the things that, you know, we talk about a lot. The physicians, we are very fortunate to have such a wonderful physician team at the Rutland Heart Center. These are doctors who have been here with Rutland Regional for many years. A new doctor, Dr. Coleman, has joined in the last couple of years, but just a very strong team. He joins Dr. Mike Robertello, Dr. Bonazinga, and of course Dr. Stanley Shapiro. So very well-known physicians in our community who are providing treatment and care at the Rutland Heart Center. So for them to have this new technology, this upgraded nuclear medicine camera is wonderful. And for patients, folks in the community to receive that level of care and to have that technology right here in the Rutland community, to your point, so they're not having to travel, is really important.
Well, and I also think, too, going back to the whole community hospital that Rutland Regional is and has portrayed itself very successfully for so long, I think people feel very connected to their providers in this community. And I think that that just makes it, you know, all the more reason to support this type of technology.
Yes, we have found, and I talk about this a lot, Peg, you and I talk about this a lot, we have a very, very generous community. Folks in Rutland County and beyond continue to support us, and that really enables campaigns like this to be successful.
And so this kind of brings me to my next question. Is this type of fundraising becoming more common in hospitals?
It is. I think many hospitals focus their fundraising on capital and facility needs. As people might imagine, there are a wide variety of needs that hospitals experience on an annual basis. We tend to kind of keep an eye on those capital needs. There are things that wouldn't make as much sense for us to fundraise for. Those things, it probably makes more sense for the hospital to invest on its own through a regular budget process. But there are things like new advanced technology that the community really seems to understand the need for that, values the importance of having that technology right here in our Rutland region. Those things make a lot of sense for us to fundraise for, and we've been fortunate to have that support. A couple of years ago, you might remember, the hospital launched a campaign in support of new 3D breast imaging technology. Right. The hospital invested in 2 new mammography units. The Rutland Health Foundation took responsibility for raising funds for 1 unit. So we had a goal of $350,000. With the community's support, we actually exceeded that goal and raised a little over $365,000. And that campaign not only raised the funds that it set out to, but it also helped the hospital raise awareness around the importance of early detection. And oftentimes these campaigns can really help us do that. It gives us the opportunity to talk about the important programs and services that are offered at Rutland Regional Medical Center and the importance of new technology, which oftentimes can help to save lives, and early detection, prevention, I think is such a big part of that.
Well, we know February is Heart Month, and so it's very timely, but also I think we have to keep remembering that heart disease is the #1 killer in the United States.
Yes.
I think people tend to forget that,
Yes.
and I think we need to keep reminding them, and that's why, you know, the hand in glove with this and the machine is so essential for this community.
I agree, and I think the opportunity over the next several months for us to talk about heart disease and cardiac care and the resource that we have in our Rutland Heart Center, and to really provide some opportunities for those physicians, that cardiac team, to be out in the community and sharing this information and really talking about the importance of cardiac care.
Because it affects us every day.
It does.
Every day of our lives. So, Tracy, where can people donate?
So if people are interested in donating in support of the campaign, they can contact the Rutland Health Foundation. We do have an online giving option on the hospital's website, www.rrmc.org. They can call us at the Rutland Health Foundation. A direct line is 802-747-3634. We are at the same address as Rutland Regional Medical Center, so 160 Allen Street. Any donations to the campaign would find us in the Rutland Health Foundation.
All right. Now, are there any final takeaways before we conclude?
Well, I always like to have that opportunity, Peg, to say thank you to our local community. Again, it's their support, their concern and interest that enable campaigns like this to be successful and really help us to bring important technology, enhance the programs and services, enhance the facility of Rutland Regional Medical Center. And I just feel that we're so fortunate year after year to see that support from the community.
Well said, as always. It's a pleasure, and thank you for being on the show.
Thank you for having me.
I want to thank all of you for watching Window on Wellness, and please watch us on Peg TV, Channel 15, or on demand at pegtv.com.
Welcome to Rutland Regional Medical Center. We are Vermont's largest community hospital with 37 specialty clinics. Healthcare organizations have always fixed people once they're broken, but at Rutland Regional Medical Center, we do more. We provide nutrition counseling, weight loss help, smoking cessation classes, all the things that help the community and individuals stay healthy. And we do it all with this promise: to listen, to respect, and to care, always.